Good evening. Thank you all for being here, and we also thank those who are here electronically by streaming video. Don't ask me what that is. My name is Steve Beyer. Please call me Steve. And my daughter, Sarah Beyer, is also here for this event. We are both part of ALS Worldwide. We are a not-for-profit organization based in a suburb of Madison, Wisconsin. And our role for many years has been to assist and support the ALS community, which we frequently call the ALS MND community, because we don't want the Brits to think that they're totally irrelevant. Certainly not the patients, and they call it motor neurone disease. But for tonight, we will try and use only ALS rather than the double acronym. We want to thank the American College of Greece for supporting this forum and for allowing us to be here, and they are so courteous and kind and wonderful, and we are so appreciative for their generosity of spirit and their generosity of action. We're here tonight to talk about ALS and ALS Worldwide, our organization, who we are and what we do for patients and families who have a loved one with ALS. We will also share with you information about the brilliant invention, the diaphragm pacing system, which is the invention of Dr. Ray Anders, the last one over there, our colleague and my very dear friend and collaborator. And Dr. Anders developed this wonderful support for those with ALS and for other conditions such as spinal cord injury, and he will tell you all about it tonight, and I think you're going to be fascinated and very appreciative of the knowledge. And Dr. Achilleas Gravanas, next to Dr. Anders, is from the University of Crete in Heraklion. And Dr. Gravanas, or Achilleas, is the inventor of a brilliant compound based on a molecule known as a microneurotrophin. And I know that everyone here, whether you are a patient, family member, loved one, friend, whomever, are all waiting for the wonderful day when we can speak of a cure for ALS. And I don't know that microneurotrophins are a cure for ALS, but so far, after over 14 years of effort in this field, it sure seems like the closest to a cure that has ever been found. And our organization is in great and deep support of Dr. Gravanas' brilliant research. So he'll tell you a lot about microneurotrophins. Another guest tonight is Dr. George Petrinos, next to Dr. Gravanas, from the University of Patras. And he'll talk to you about a very, very unusual and great subject, and that is the genetics of ALS and how those genetics are of specific particular interest to the Greek ALS community, because so much of his work is based, virtually all of his work is based on the ALS phenotype that is present in those from Greece, and which accounts for why there is such a high level of ALS within the Greek community, which I believe to be one of the highest national ALS groups percentage-wise in the world. After that, we'll have time for questions and answers. So I am hopeful that everyone will be quick of tongue, which I know I'm not. And I now welcome Sarah Beyer to continue this.
We just wanted to share with you a little bit about our history, because I think as the Director of Outreach and Counseling for ALS Worldwide, we work with patients and families all over the world, and so often one of the first things I will tell people is that my brother had ALS, and he was diagnosed officially when he was 31, and he passed away when he was 37. So he'd had symptoms like many people do for a couple years probably before his official diagnosis. So we really, as my brother and Steve's son, we really do understand what it's like to have a loved one living with ALS. And that's so much why we do this. We don't want anyone to ever feel that they are alone and that they don't have anyone to reach out to for support. And we do that in a lot of different ways. One of them being that if people want to talk to us, we need a little information from them so we can connect, and then we will talk either through Skype, which is a wonderful way to see each other. I know there's someone here who I've personally connected with on Skype, and she walked in and I knew her right away. And to me, if we can't be in Greece all the time, we can Skype and be able to see one another and talk about things that might help your loved one or talk about how you're doing. ALS affects many lives, many family members and loved ones, and so we don't ever want people to feel alone. So if there are people out there who want to get connected, please take my card, take my information, talk to me. I have everyone's emails, so I'd like to share that with everyone so that you all can get connected as well. So I will take that first step, but please don't hesitate to reach out to me if you ever want to talk more. And then Steve is going to talk about some medications for what we can share with people.
Thank you. We are always looking for answers and supportive devices and pharmaceuticals and supplements, and we've been remarkably lucky and perhaps even successful in finding some of these. And we are in the habit of treating ALS symptomatically, because until now or sometime in the future, the near future we hope, there is no cure. So ALS is called a disease of symptoms. People don't die from ALS itself. They die from respiratory failure, they die from pneumonia or other infection, and they die from malnutrition. So those are the three key categories that we look for in the way of medications or other methods that will prevent those things from happening. And in addition, those terrible, terrible side effects of ALS, the absence of speech, the absence of movement, all of the symptoms that unfortunately we all know so well, our goal there is to provide medication that will somehow minimize or alleviate, stop, and sometimes even with God's will and science, turn around some of the symptoms. And that does happen. It doesn't mean that these things have curative power, but it does mean that they are so successful in treating symptoms that people feel better, act better, are able to do things that they weren't able to do before. Now, you tell me, do you want to know what some of these medications are? Yes? No? Okay. I mean, I thought so, but... And you don't have to remember any of this. All you have to remember is to go to our website, because everything we know or think we know is on our website. And you may have to pore through it because we put everything on there. You know, if we think something is good and then we think something is better, both of them are on there. But here are the medications and supplements, hello doggy, that we favor for those with ALS. And I'm just going to wait until this young lady and her doggie. How are you? Okay. So often, those with ALS suffer from an accumulation of phlegm and mucus. Phlegm is in the throat and mucus is in the nose, and they can't get it out. Now, I'm only going to give you the bare bones for each of these because to tell you all of the detail would take too much time, too much of your effort and concentration, and again, you can find it on our website. And most of these are very inexpensive treatments, too. There's a product called Pharmanac, and there were some samples of it up front. I don't know if there are any still left. I forgot to bring more of them. But it's a wonderful medication. It's a round disc. It looks like an Alka-Seltzer, if you remember those. You dissolve it in water. You drink it down, or if the patient is on a feeding tube, it can be put in right through the peg, the feeding tube, and it dissolves the mucus and phlegm. It doesn't get rid of it, but instead of it being a gooey, sticky mess, it becomes little tiny bits which can easily be coughed up or sneezed up. And it has saved so many people from choking and aspiration, and it's a wonder. And it's available online. You can get it here, you can get it from Amazon, you can get it many places. Because we work with so many people in Greece, we're even going to try and have a large shipment brought here, which can then be sent out to individuals, so it doesn't have to go through Greek customs all the time. Secondly, we recommend a product called methylcobalamin. Now, methylcobalamin is a very fancy word for vitamin B12, but it's an injectable form of vitamin B12. And do you know what the purpose of B12 is? It's to bring energy, whether it's energy to your whole body or energy to a given part. So we provide this super high dosage. When I say we provide, we're not a pharmacy. We tell people where to get these things and how to use them, okay? So don't mistake the word we. We don't sell anything. Methylcobalamin can be injected in very high dosage, and it's done in the arm for benefit in the rest of the arm and the hand. And it's done in the other arm if you want relief there. And it's done behind the thigh for your leg and behind the other thigh for the other leg. And this methylcobalamin high dosage injection brings a relief that is just amazing. I have a phrase, nobody ever stops using methylcobalamin because they just absolutely love it. They can wiggle fingers, and if they can't wiggle fingers, at least they have feeling in their hands. So, and the same in the legs and the feet. A third product that we use is called glutathione, and this is a supplement. Glutathione is present in all of our bodies. And glutathione, when injected, again in a very high dosage, and it has to be injected by somebody else. Methylcobalamin you can do yourself if your hands are capable of it. But glutathione you have to have injected by somebody else, and it's a little more complicated. But the wonderful thing about glutathione is that it appears to dramatically slow the disease. So if you want to learn more, again, go to the website. There's what we call a miracle drug. It's called Nudexta. And Nudexta is a combination of two very simple ingredients. I won't tell you now what they are, but they're very, very simple ingredients. And it's a brilliant invention. It was invented for PBA, or what is called pseudobulbar affect. And that's the part of ALS that affects maybe half of the ALS community, where they experience disproportionate laughter or crying. They have excess emotionality. And you don't have to raise hands to say you do or don't know of this, but if there are 100 patients here, 50 or 60 may experience that. And it's a terrible thing. When I first saw it happen in our son, I said, without thinking, "Why are you giggling at me?" And he answered me in a very proper way. He said, "You of all people are asking me that?" Because I just didn't think of it. And I didn't realize that he was affected by pseudobulbar affect. So this drug, this simple combination of 2 ingredients, resolves pseudobulbar affect. You take one in the morning and one in the evening, no more pseudobulbar affect, no more disproportionate laughter or crying. But here's the wonderful part, if that wasn't wonderful enough. It also helps virtually all other bulbar symptoms: chewing, swallowing, rigid facial muscles, the inability to move one's tongue or lips or jaw, even a little bit for breathing. It helps in the upper respiratory tract, not down here, not by the diaphragms, but way up here. It helps to ease the ability to breathe. So chewing, swallowing, so eating food perhaps more normally than through a feeding tube, or sometimes. So all of these things can be done by Nuedexta when it works. Will it work with everyone? Probably not. But I will say it has a higher proportion of working with people than any other medication we've tried in our 14 years of effort. It's a brilliant drug, and here's the great part. It can be compounded generically, so instead of a cost of $1,500 a month, it costs about 75 cents a capsule, or that's US dollars. So in other words, $1.50 a day, which is maybe $45 per month. A capsule that can do that much, it's truly a blessing. Another drug, faster, got it. Another drug, the old-fashioned Rilotec or Riluzole. People have pretty much stopped using it because they say, oh, it's expensive and it doesn't do anything. It only extends life by perhaps 3 to 4 months according to the test results. There's another reason for using Rilotec, or the generic word Riluzole, and that well, 2 reasons. One reason, it's now generic. So instead of $1,500 a month, it's $4 a tablet. So every day that's $8. So it's far, far under the former cost, even if it isn't covered by your insurance, which hopefully it would be. But here's why you take it, because it activates other drugs such as Nuedexta. It makes it work better. So if Nuedexta is going to help you, take Rilotec too, and that will help the Nuedexta work even better for you. Effexor. It's a drug sort of like a tranquilizer, except it's a mood equalizer, and it's very mild. It takes the edge off of the horribleness of having ALS. And we have recommended it many, many times, and it's, again, it's like Nuedexta. Nobody stops using it. Quinine sulfate, invented about 400 years ago by Amazon Indians. Quinine, okay? Very simple product. We have had patients whose rigidity, their spasticity was so great that one lady, her husband, a physician, sent me a video of her lying in bed like this, except if this is where her thigh was, her leg was up like this. She was literally sleeping with her leg at a 45-degree angle. The only thing that resolved it was quinine sulfate, which again is a generic formula. It costs virtually nothing, and who wants that horrible rigidity and spasticity? Vitamin D3, the sunshine drug. It has a wonderful effect on those with ALS. Lots of different ways. You don't even have to know how now. You can find out on the website, but get it. It's inexpensive. It'll help your mood. It'll help so many parts of having ALS. Celtropine, another ancient remedy from the Indian tribes of South America. And celtropine will help to dry up the excess saliva. And I think everyone in this room must know that those with ALS have a terrible time with saliva, or the fancy word sialorrhea. And you know what that is. It is the continual drooling that has to be dealt with by a handkerchief, a napkin, or whatever. So you want to stop it? Try Celltropine. You'll read it on our website. There are other drugs, but those are the most important. Oh, I do have to mention one other. It's not a drug, but it's a treatment because it comes from Greece. And that is a hundreds of year old formula. And that is, if there is no danger of the patient choking on it, you can give them an olive, a green olive, and I'm even told that it's the one with the pimento inside, it works better, and a piece of lemon. And those two ingredients have a remarkable effect on drying up saliva. So you can either get the medication that I've mentioned, or you can try the Greek formula from hundreds and hundreds of years ago. By the way, many people have tried it and they think it's great. So those are some, not all, but as many as I think we have time for tonight, or perhaps even I've passed that. But those are medications, supplements, that if you'll go to our website, and then if you'll contact Sarah, me, or anybody else, and Sarah's really the best, by email, she'll arrange for you to get these drugs the easiest possible way that we know.
He listened to my instruction. I just wanted to mention one thing because, of course, what Steve is talking about is why we're here also. We're always optimistic. We're always looking for what's out there, and we're always trying to be very hopeful. And one thing I just wanted to mention that came out of talking with a patient who said to us, you know, I was at a concert and people kept bumping into me, and I couldn't speak very well, so I couldn't explain to them what was going on. So the cards that we have outside are translated into Greek. It's just something that came out of this patient telling us, you know, that was a frustrating experience for him. So we thought about that and thought, what could we do that would make it easier for people? So please feel free to take as many of these as you think you want, or your friends want, or patients that you know or work with. And it can be printed from our website. It's in Greek. And it just has a place to explain to someone, if you're not able to speak very well, about what ALS is and who you are and what you may need as support when you're out and about. So that is why those are here. And please, again, take as many as you'd like. I think we should move on to our speakers.
Yes. Let me just